Kate Sheehan and I'm a pelvic floor physical therapist. Today I wanted to talk to you about pelvic organ splinting. Splinting is a treatment technique that's often used for pelvic organ prolapse. A lot of the times though, patients don't know they have pelvic organ prolapse. So if any of these symptoms sound right, or if you try this treatment technique and it works for you, I encourage you to check in with your provider or a pelvic floor physical therapist for more details. For all of these techniques of splinting, you want to make sure that you're sitting on the toilet and ready to evacuate more urine or bowel movement. At that time, you also want to make sure that you have a clean hand and some toilet paper may be helpful to wrap around your finger, okay? Now, when you're sitting on the toilet, let's talk about external splinting first. Oftentimes, patients feel more comfortable with external splinting because it's not as specific as the internal splinting. If this is my pelvis here, just imagine there's skin on top, and this is a female pelvis, by the way. You're gonna take your hand, and like I said, you can have toilet paper wrapped around it, and you're gonna first just gently press on the perineum. You're gonna press upward toward your head, okay? Now, this is where the toilet paper really comes into play because you might find that you end up urinating a little bit on your hand, and that's okay. That's kind of what's supposed to happen to help you fully empty, okay? So toilet paper, and just press directly up toward your head. Oftentimes patients will say that when they do this, they feel like they need to go to the bathroom more. Then you kind of know, okay, this is the right spot. You want to make sure that the pelvic floor is relaxing at that time because that's what lets urine and bowel movement come back out. Next is internal splinting. Internal splinting can be used for the bowel, the bladder, or for both, okay? So if you think about that same pelvis, this one here. Now I have a smaller version of it, but it's the same thing just for ease of seeing. If I have that same pelvis, okay, right here, I've got my spine in the back, I've got the rectum, the vagina, and then the urethra right here, okay? This is my bladder. If the bladder is sitting a little bit further backward than it should, you might see it in the vaginal canal, and that can often cause some pressure, okay? When we're splinting the bladder, all you're going to do is same technique with a clean hand sitting on the toilet or with toilet paper wrapped around it. You're going to take your finger and make sure that you find the perineum, and then you're just going to gently insert the finger into the vagina and you're going to pull forward, okay? So here's a side view, right? Into the vagina and push forward toward the pubic bone. You may feel a little bit of pressure when you do this, but it should not be painful at all. And you may end up urinating on your hand or on the toilet paper. This is all a good sign because it means that you are allowing that bladder to be in a better resting position rather than laying further backward and resting on the vagina. Next is internal splinting for the rectum or the bowels, okay? Now, here's my same pelvis here. If you can imagine, vagina and urethra is in the front there. And then we have the rectum with the anus around it here, okay? If the rectum is slightly sitting more forward, it can cause more pressure on the vagina and even cause a little bit of a shelf for the bowel movement to get stuck on. This is what can cause constipation or a feeling of incomplete emptying, okay? Now, if it's resting more forward, you see here, then that position of the rectum itself is not really in a good, nice, straight tube to let bowel movements come out. So, in general, it does rest a little bit backward. Anytime it's resting forward, it can cause a bit of a kink in the hose, just like it does for the bladder. So all you're going to do for your finger internally with a clean hand or with some toilet paper wrapped around it like we talked about, you're still going to insert the finger vaginally. Sometimes people feel that using their thumb is a little bit more beneficial in this position for the bowels. What you're going to do is you'll find the perineum, you will insert the thumb or the finger, and you're just going to press backward toward your tailbone or toward your spine, okay? That way you're pressing the bowel further back rather than letting it rest in a forward position like this, okay? Now that's the thumb technique. The finger technique would be the same. You would insert the finger vaginally and press backward.